Without question, a CT scan can be a life-saving medical tool that can provide an early diagnosis of disease. But it can also cause another unintentional effect, radiation overdose. It's happening more and more at hospitals around the country, and as we found, perhaps here in Georgia, miscalibrated machines or operator error exposing patients to dangerous doses of radiation.
I thought there's something wrong with me.
She went into the hospital for healing and came out suffering. A routine CT scan that an Alabama teacher says went terribly wrong. A scorching overdose of radiation.
Then the nausea and the headache started.
Becky Couder is haunted by what happened when she underwent a CT scan at Huntsville Hospital. Her hair grew back, but she says she still suffers from nausea, dizziness, and blurry vision.
It's gotten worse. I keep waiting for it to get better.
Couder is not alone. In Los Angeles at Cedars-Sinai Medical Center, hundreds of patients were exposed to more than 8 times the proper dose of radiation. The hospital in Missouri revealed a miscalibrated machine in operation for years had over-radiated 76 patients. And in Huntsville, Alabama, where Couder had her procedure, about 60 patients are being notified they may have been exposed to hazardous levels of radiation that could prove life-threatening.
That's what we're concerned about, is that she might develop cancer, not in the next 6 months, not maybe in the next year, but in 5, 10, 15 years down the road.
Emory cardiologist Reza Fazel led a study that determined the use of CT scans is increasing at a staggering rate and exposing a growing number of patients to possible cancer-causing radiation. He says the skyrocketing reports of radiation overdoses reveal a dangerous lack of oversight.
This has kind of brought to light the issue that there's really very little monitoring or regulation in terms of safety measures or quality control.
Another concern, most manufacturers of scanners do not install warning mechanisms to alert operators before dangerous levels of radiation are administered. And some in the medical community say the requirements to operate a CT scanner need to be tougher. Right now, Georgia requires 2 years of training to become hospital certified.
This is all about the wreck.
Recently, Seal Lucas of Marietta fractured a neck vertebra in a head-on collision. As part of her recovery, she received 6 CT scans over a 3-month period. And 2 of them were done within 30 minutes, all in her upper body.
After we came home from the hospital, I did have a long spot in the very back of my neck. It was probably about 3 inches long.
Doctors gave her no explanation for the loss of hair, which grew back. But within a few months, she made another disturbing discovery.
Cancer in my right breast, and wound up having to have a double mastectomy.
Seal Lucas may never know if there's a link between her exposure and her breast cancer. But she, along with Becky Couder, hope more will be done to educate the public on the risks of CT scans.
Doctors need to be more cognizant of how many tests that they're ordering and if they're really, really needed.
Now, although there are no reports of radiation overdoses at any Georgia hospitals, we wanted to know how they are responding. So head to WSBTV.com for more details. We have compiled statements from 6 of the larger metro